Okay, we're going to do some trach care on my patient, Mrs. Smith. Before entering the room, I went ahead and made sure I had all my supplies. We had a trach care kit. We had the sterile suction canisters and kit that I got a face mask just in case there's some sputum spit up, and then there's I also had some syringes that I need to get, saline syringes, and then make sure in the room that I had extra inner cannulas if they had a disposable set. Also a trach mask to oxygenate the patient and a resuscitation bag just in case. So first thing I'm going to do is enter into the patient's room. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory team here at the hospital. We're going to go ahead and do your trach care, okay? Okay, great. How's that trach feeling right now? Is it irritated, itchy, excessive oozing, or anything like that? I'm just going to go ahead and do a quick assessment before we get started. Wash my hands. I put on some gloves. I'm going to listen to her breath sounds. I'm going to check her vitals. And I'm going to check the cuff pressure on the trach and make sure it's between 20 and 30. So now I can go ahead and get started. I'm going to hyperoxygenate Mrs. Smith. Now I'm going to open up my suction, my sterile suction. The canister's already hooked up there on the wall because we did trach care earlier that day. Should be done at least twice a day. So first thing I see is some gloves. I'm going to have a clean hand, and then my right hand is going to be my sterile hand. I'm going to go ahead and grab the catheter with my sterile hand, hook up to the suction with my clean hand, and make sure I have some lubricant on there. And we're going to go ahead and suction Miss Smith out. Okay, Mrs. Smith, here we go. I'm going to insert and make sure I do it smoothly, and feel a little resistance, back up and occlude the thumb port and start suctioning. Shouldn't take more than 15 seconds there. Go ahead and do that. Now we'll go ahead and oxygenate her again, and we'll get started on cleaning the stoma site, okay? We'll go ahead and untie the trach collar. I'm going to take out the inner cannula. If it is a disposable one, we'll get rid of it. If not, we can clean it. There's some pipettes and gauze and sterile saline in our kit here. And then we'll go ahead and take out this gauze. I want to make sure that I keep the trach secured in there. We'll get rid of that. Now I'm going to go ahead and start cleaning the stoma site. I poured some saline into my little basin there, and with each swipe I'm going to go from inward, outward, and then toss, not reusing swipes. So go through quite a bit of Q-tips and work our way all the way around, inspecting the stoma all the way through for any signs of infection, drainage, pus, foul smell, redness, irritation. So now we can go ahead and let it air dry. We're going to put a new gauze underneath Mrs. Smith here, protect her skin. Tie a new trach collar down, and then we're going to go ahead and insert a new cannula. We want to make sure that we have a extra cannulas in the room just in case of same size and smaller size in case there was any obstruction of the airway, swelling, things like that. We're easily available to go ahead and put the smaller size in. Now I'll go ahead and reassess my patient, checking that cuff pressure and vital signs, SpO2. Go ahead and clean up my stuff here, put the patient in a comfortable position with her call light, and make sure I communicate with the nursing staff that it was done that day. All right, that's it.